It seems to me that the nature of the patients that we're serving has changed greatly. We have far more challenge, I think, now from people with personality disorders. Drug use, well, of course, there was recreational drug use 20 years ago, but perhaps going back even 5 or 6 years, you'd be a very smart mental health nurse if you could even define what dual diagnosis was, or if you'd even heard of the term. Now, I would guess it's something like, I don't know, you tell me, guys, about 75% of your patients are using street drugs, I would have thought, possibly higher. Nearly all your psychotic patients are going to be using street drugs. We know what that means. That's likely to lead to people being more disturbed, less likely to respond to treatment regimes. It's more likely to make people unpredictable. The link between extremes of behaviour and substance use is very clear. It's likely also that people are going to be engaged in a rather sort of anti-authority sort of culture. It may well be that offending is a regular part of the lifestyle of many of our drug-using, substance-using patients. So that's one change. The issue about personality disorder is another interesting one. I think these are people who, to use a cliche perhaps, the squeaky wheel gets the grease. These are people who many of us feel, I'm sure Len can advise us on the research on this, but many of us feel that these are people who are probably not well served by coming into acute environments. They're probably not well served by coming into environments where there's both a system which takes responsibility away from the client and a system in which it's very difficult to, once these people are engaged,